Nephrotic syndrome isn't a single disease, but a collection of symptoms that signal something's awry with your kidneys. It all begins with the glomeruli, tiny blood vessel clusters in your kidneys that work as your body's filtration system. When these glomeruli sustain damage due to various diseases, it disrupts the normal filtration barrier, allowing large molecules like proteins to escape into the urine, a condition known as proteinuria. But what makes the kidney's filtration barrier so special? It consists of 3 layers: endothelial cells, the glomerular basement membrane, and podocytes. Damaging any of these layers increases the permeability of the barrier, causing proteins to leak into the urine. One of the proteins that slips through this damaged barrier is albumin, a crucial player in maintaining the balance of fluid within blood vessels. As albumin levels in the bloodstream decrease, a condition called hypoalbuminemia, it disrupts the fluid balance between blood vessels and surrounding tissues. This imbalance, along with the body's compensatory mechanisms, leads to fluid accumulation in tissues, or edema. While edema often affects the lower extremities like ankles and feet, it can also show up in the abdomen and around the eyes. Now, when the body loses proteins, the liver tries to compensate by increasing the synthesis of lipoproteins, leading to a rise in cholesterol and triglyceride levels, a condition known as hyperlipidemia. The plot thickens with the activation of the renin-angiotensin-aldosterone system, or RAS. Triggered by a decrease in blood volume, RAS activation prompts the kidneys to retain sodium and water, further contributing to edema and potentially leading to high blood pressure. Interestingly, some forms of nephrotic syndrome are linked to immune system abnormalities, such as immune-mediated glomerular injury or dysregulation of immune responses. These abnormalities can exacerbate glomerular damage and proteinuria. In summary, nephrotic syndrome is a complex disorder resulting from various underlying kidney diseases. It starts with damage to the glomeruli, leading to proteinuria, hypoalbuminemia, edema, and hyperlipidemia. The body's attempts to compensate for these changes can further exacerbate the condition and contribute to additional symptoms like hypertension. The underlying cause of nephrotic syndrome can differ from person to person, with conditions ranging from minimal change disease to membranous nephropathy. Treatment focuses on managing the underlying cause, alleviating symptoms, and preventing complications. So the next time you see swollen ankles or feet, remember, it could be more than just a long day on your feet. It might just be a sign that the kidney's delicate balance has been upset. As always, understanding the pathology is the first step towards effective treatment and management. Until next time, stay curious.